Dr Kyle Hoath is a psychiatrist. He's president of the AMA here in WA and with me now. Good morning, Doctor.
Good morning, Nadia.
So what was your reaction to what the Auditor General had to say?
Oh, look, it's incredibly disappointing. I think mad probably is the right word. I mean, we were pretty happy at the time when we had these sort of 32 recommendations passed down, and government made a very quick commitment to adopting them all and implementing them. But as we found out earlier this week, only one has been implemented, and there's still actually a number that haven't even been commenced on yet. So it's incredibly disappointing and frustrating when we know the challenges we face in health and in mental health in particular, and that just this inaction in this space is unacceptable.
Well, how would you describe the system right now?
Oh, look, it's completely disconnected. I think between the public offering to kids and families, the private sector, our GP specialists, there's just too much disconnection rather than a seamless flow through for parents looking for a way to get their children help. Like, it needs to be much clearer. It needs to be a much simpler entry into the front door for these young Australians, so that we can prevent a lot of this suffering, so that we can have earlier intervention, so that we can have a bigger impact.
And is it too reliant on crisis care rather than prevention?
Yeah, and that's a lot of what the recommendations looked at, was putting more resources and a shift towards early intervention, prevention, wraparound multidisciplinary services that connected the public, private and GP sectors to make it an easier system to navigate, but an easier system to deliver care to kids sooner, so that we weren't waiting to the point of being in crisis. Some of the recommendations that have been progressed close to completion were the ones around crisis, and that is important and will always be an important part of the system, but it can't be the only part of the system.
Dr Kyle Hoath is my guest this morning, President of the Australian Medical Association, also a psychiatrist, so knows this world very, very well. You want 3 urgent actions. What are they?
Yeah, look, the main one we're calling for is a public disclosure and commitment to seeing these recommendations implemented. So we want to see the plan, we want to see progress towards that, and we want to know who's accountable and how that'll be funded. These were publicly made recommendations that were accepted by the government. We want to see that monitored. We want to see that tracked. We want to know that this is going to happen. We don't want another review. The review's been done. We need to see action on this.
Because we know what needs to happen.
Because we know, exactly. Yeah. We've got it there. We've got the blueprint there. We need to just make sure we execute it. And then the last piece to that is to make sure that we have the workforce to support it. Largely that's covered by the recommendations as well.
The Minister's response yesterday, disappointed, we'll take the recommendations on board. How did you react to that?
Yeah, look, disappointed. I think that's probably the right word. I don't know. This can't keep slipping, and I think whose responsibility it is something that needs to be very clear. Whether it sits with the government, the Mental Health Commission, the Department of Health, we need some leadership here. So I'm hopeful that the Minister will take the time to digest this and come back out with a strong commitment to seeing these recommendations implemented during her term.
And also, I mean, this was on the Mental Health Commission. That hasn't followed through. I mean, what does that say about the people there and their ability to bring in some pretty urgent reforms that were urgent 4 years ago?
Yeah, again, I think it comes back to who's responsible and how they're resourced and empowered to make this happen. And when we have a complex system, when there are multiple agencies that look after this part, I mean, between the country services, child and adolescent services, the department, the government, the Mental Health Commission, there's too much ability for buck passing there. So we need that really clear around who's going to take control, and they need to be empowered to make this change, so that we're not continuing to languish in this sort of half-baked state that we're at the moment.
It's a pretty sad state of affairs, isn't it? I mean, we're talking about kids here.
That's right. We're talking about kids' mental health here.
And at a time when kids are experiencing more challenges when it comes to mental health. I mean, you tell me, what are the statistics saying about where kids are at right now?
Yeah, certainly since COVID, we've seen that there's been a bit of a jump up. I mean, it was already tracking that way with a lot of social media and the way kids interact with each other and other things online. So we're already seeing a bit of a trend towards, high rates of stress, burnout, anxiety, depression. It's really disheartening that becomes a problem if we can't get these kids earlier intervention. If we can't get them earlier help, it only compounds the problem and creates bigger risks down the road. So yeah, it is scary, Nadia. We really do want to make sure that this is something that is handled with as an absolute priority.
Absolutely, and we'll keep talking about it on this show. Thanks for your time, Doctor.
My pleasure. Thanks, Nadia.
Dr Kyle Hoath there, President of the Australian Medical Association in WA. He's also a psychiatrist. A lot of you are not happy with what's unfolded, and there's no excuse. I don't think there's any excuse. Health Minister didn't want to talk to me this week. Look, I understand Parliament was sitting. She was probably quite busy. We'll go back to her again and ask her, the Mental Health Minister, who's also the Health Minister, and ask her if she would like to come on next week and tell me how she's going to fix this, because they've had 4 years, one recommendation that's been followed through. An appalling state of affairs.